Thank you and a very warm welcome to all our esteemed guests and the personalities who have taken healthcare to a new light. And yes, as we all know, health is wealth. And on this wonderful conglomerate, bringing all the stalwarts of the healthcare, we will be starting our panel discussion. And I would like to invite Dr. Swapnil Sharma from LH Hiranandani Hospital. Dr. Ramakant Deshpande from ACI Kambala Hill Hospital. Dr. Sneha Shashank from Zainova Shalbai Hospital. Dr. Arun Shah from Bharatiya Arogya Nidhi Hospital. We are waiting for our panelists to join in. So I guess till then we settle down. And since we need to cover up this time because we are waiting for our panelists, let me just share something really important about healthcare. As we all know, jaan hai to jahan hai. And yes, the people who give us the jaan truly need to be honored. Not just on a day, but every day, just like breath. And I guess we need to welcome them with a big round of applause. Midday has come with such a wonderful concept of bringing the stalwarts of healthcare, the super specialists as we call, bringing them together, understanding what holds good today, what's working today, and what we could look forward to in the future. Because from the current is what we form the future. And when we are able to understand this concept, we will be able to take care of ourselves, not just for the current life of being happy and healthy, but also seeing that we have a longevity of life which is happier. As we all know, living joyously should be the mission of every human being, and they form that particular engine which will be fueled on a regular basis so we can live life joyously. This panel discussion is basically to bring about an understanding to all of us as to what is happening in the various fields of super specialty. And when we have an understanding, we also come to compromise ourselves into understanding that things are not beyond control. Often, the biggest problem that man faces is not understanding the emotions, how to handle them. Once any particular disease is being showcased through their reports, and we are all aware about it. So when we have the stalwarts and the super specialists from their fields sharing where we can see that ray of hope, I think life becomes better. And I'm sure all of you will agree to this concept, because that's exactly why Midday has brought in the best of the healthcare industry together to share the wisdom, the knowledge, the expertise that they hold in their respective fields. We have Dr. Lahoti who's joined in now, and we welcome him with a big round of applause. MGM, New Mumbai Hospital. So let me introduce our esteemed panel, wherein we are having the super specialist with us, and we will be looking around what makes their hospitals so special. And that's the reason they are here. So we start with Dr. Swapnil Sharma, who is a consultant and chief liver transplant and HPV surgeon at Dr. LH Hiranandani Hospital, which is a 244-bedded multi-speciality, super speciality, tertiary and quaternary care hospital commissioned in February 2024. 22nd of February 2004. The hospital was built in the honor of Padma Bhushan Dr. L.H. Hiranandani, the chairman of the hospital and father of Dr. Niranjan Hiranandani and Mr. Surendra Hiranandani. The hospital is located at the Hiranandani Gardens in the northwest sector. The hospital was the first to secure the NABH accreditation in Mumbai, NABL accreditation, NABH accreditation for blood bank in the western region of India. They need to be applauded for that. The hospital is also the winner of the prestigious Ramkrishna Bajaj National Quality Award in the year 2008 and 2015, so twice. As a multi-specialty tertiary and quaternary care hospital, we are proud to identify ourselves as a frontline provider of comprehensive health care. Within a short span of from 2004, we have as a frontline provider of comprehensive healthcare moved from 130-bed hospital to a formidable 240-bed hospital. The expansion which overtook not only added beds but also newer service modalities. The hospital was modernized and we are now in the same league with the best hospitals in the world. Introduction about our doctor, Dr. Swapnil Sharma. Dr. Swapnil Sharma, consultant and chief surgeon liver transplant, hepatobiliary, pancreas and GI surgery, MBBS, MS in general surgery, DNB, GI surgery, fellowship in liver transplant and HPB surgery. Dr. Swapnil Sharma is a consultant and chief liver transplant, hepatobiliary, pancreas and GI surgery with over 15 years of experience. After completing his training, Dr. Swapnil has worked at various leading hospitals before setting up liver transplant unit at Dr. L.H. Iranandani Hospital in Mumbai. He performs all types of liver transplants, including liver donor and deceased donor liver transplant, adult as well as pediatric liver transplant. He performs ABO incompatible liver transplant as well. Besides liver transplantation, he performs complex GI surgeries like multivisceral resection, portal hypertension surgery, that is the shunt surgery, hepatobiliary and pancreatic surgery, liver resection, and complex stomach and intestinal surgery. His areas of interest are liver transplant, hepatobiliary, pancreatic surgery, and complex GI surgery. He has done many studies in liver transplant as well as GI field and presented in various international and national conferences. We welcome you, Dr. Swapnil. We can have a round of applause.
Thank you.
We have our next panelist from Zainova Shelby Hospital, Dr. Sneha Shashank. About the hospital. Zainova Shelby Hospital, a premier multi-specialty healthcare facility located at the heart of Ghatkopar, with the commitment of providing quality, personalized healthcare since 2007. They offer a comprehensive range of services under one roof. Facilities, 100 beds, offering super deluxe suites, deluxe rooms, single rooms, twin sharing and multi-sharing options for your comfort. And the advanced ICU, state-of-art, centrally monitored ICUs, high dependency units, that's called as the HDU, and neonatal ICUs, they ensure optimal care. Commitment to excellence is what Zainova Shelby Hospital stands for. They provide their commitment to excellence. They also share that a highly educated and skilled physician, along with dedicated medical staff, ensures personalized care tailored to the individual needs. By partnering with Shelby Hospital, they bring a cutting-edge technology in diagnostics to enhance patient care. Patient-centered approach, and they believe that each individual is unique and deserves personal attention. The team of doctors who are highly experienced, the nurses, clinicians, specialized in providing comprehensive care across all departments. So feel free to share your questions and concerns with their team who are dedicated to exceeding the expectations and ensuring a positive healthcare experience. The difference of Shelby hospitals where compassionate support meets uncompromising standard of care. We welcome them with a round of applause. About Dr. Sneha Shashank, who is a DM in neurology, SGPGI Senior Consultant Neurologist. Practice locations have been Zainova Shelby Multi-Speciality Hospital, Ghatkopar West, L.H. Hiranandani Hospital, Powai. And his academic qualifications, MBBS, SMS Medical College, Jaipur, MD in General Medicine, JLN Medical College, Ajmer, DM Neurology, SGPGI College, Lucknow in 1999. Dr. Sneha Shashank, with over decades of experience, is a seasoned neurologist specializing in stroke, epilepsy, and migraine management. He has a strong academic background with numerous international publications to his credit. Dr. Shashank is dedicated to providing comprehensive care and is currently focused on developing a state-of-art stroke unit at Zainova Shelby Hospital. We welcome you, Doctor. We come to our next panelist from Bharatiya Arogya Nidhi Hospital, Dr. Arun Shah, consultant nephrologist. Bharatiya Arogya Nidhi is set up with a holistic approach towards patient care based on ethics, quality care, and professionalism, backed by affordable prices. The hospital is focused on providing a human touch, homely environment, being a home away from home, with a classic ambience as well as cutting-edge technology which sets it apart. BANH was awarded as the Kaya Kalp Award by the Ministry of Health and Family Welfare in 2020 for Best in Infection Control. Bharatiya Arogya Nidhi has successfully completed 46 years of selfless service to humanity in rendering medical treatment and has been awarded for Best Healthcare Services in 2023 by Midday. We can welcome them with a round of applause. About Dr. Arun Shah, who is the consultant nephrologist. Dr. B. Arun Shah is a consultant nephrologist and one of the most renowned renal doctors in India and is practicing at Bharatiya Arogya Nidhi Hospital in Mumbai. Dr. Shah has been associated with Bharatiya Arogya Nidhi since 1985. He has an overall experience of more than 30 years. He has been the pioneer of nephrology department at the Bharatiya Arogya Nidhi Hospital, starting the department with just 2 beds, now bringing up to 14 beds. He has been presented with the Best Physician Award on Doctor's Day by IMA BW Branch 2013. He has also been recipient of the Dronacharya Award this year by Society of Renal Physicians. We welcome him with a big round of applause. Welcome, Doctor. We have MGM New Bombay Hospital. Dr. Harshal Lahoti, consultant into interventional cardiology. MGM New Mumbai Hospital is a name which is synonym with best multi-speciality. A name where dignity of patient is of paramount importance and believes in giving the best to the society. An efficient caregiver, and they also feel that care receivers have to be mutually respected. Working on the aspect of having the best state-of-art technology and best of the doctors which embrace each other, creating an ambience of right contribution and also keeping their patients happy, as rightly written as caregivers and care receivers. A name which believes in the 3 C's: care, compassion, and cure. We welcome them with a big round of applause. About Dr. Harshal Lahoti. Dr. Harshal, who is an MD, DNB, TM in cardiology, FSCI, USA, consultant interventional cardiologist at MGM New Bombay Hospital, Vashi, former assistant professor, Maharashtra University of Health Sciences. He is awarded honorary associate membership of American College of Cardiology and in the field of cardiology. He is a highly enthusiastic, skilled interventional cardiologist who proactively participates in various seminars, talks, and he is highly adept to complex cardiac interventions like the TAVI. Dr. Lahoti, apart from being a very good doctor, is also a very good human being and is extremely soft-spoken. He is also very dedicated to his work and is always available to help his patients. We welcome you, Doctor. We have a big round of applause. And now we welcome Dr. Ramakant Deshpande from ACI Kambala Hill Hospital. The introduction of the hospital goes as, we all know, an leading institute in the field of cancer. NABH accredited tertiary care hospital with state-of-art facility and highly qualified cum well-trained personnel with continuous pursuit of its commitment as per its renowned legacy, vision, and mission. They also look at administering the latest cum affordable medical care to the community. This organization shall be shortly announced the opening of its world-class multidisciplinary hospital at Bhubaneswar and a cancer care unit with modern radiotherapy treatment at Virar, along with acquiring a major medical entity in Pune, cancer care hospital in Surat, and establishing a comprehensive cancer infirmary in Kolkata. So they are spreading the wings, I guess, across the country. Mumbai-based Asian Cancer Institute, known as ACI Kambala Hill Hospital, has 50 beds, of which 11 are exclusively dedicated to critical care, with 3 fully equipped operation theaters, cardiac catheterization unit, robotic surgery suites, endoscopy department, isolation and daycare amenities, especially for chemotherapy. We welcome them here with a round of applause. Dr. Ramakant Deshpande is the chairperson of Asian Cancer Institute and a luminary among India's leading cancer specialists. He is at the forefront of transformative cancer care. His exemplary clinical journey reflects the evolution of thoracic surgery, particularly the transition from conventional invasive procedures to widespread adoption of minimally invasive techniques. He introduced thoracoscopic surgery at Mumbai's Tata Memorial Hospital, which was instrumental in signifying a paradigm shift in this country's oncology intervention management. As the chairman of Asian Cancer Institute, his mission is to continuously strive in making world-class medical facility universally accessible. This determination, along with implementation of rigorous patient safety measures and accreditation from NABH, consolidate ACI as a paragon of quality and safety. His vision is a future where disease, especially cancer, is not just treated but conquered. As an acknowledgement and recognition of his invaluable commitment cum contribution in the dynamic landscape of healthcare, the Indian government conferred him with the prestigious Padma Shri Award. We welcome you, Doctor. Having had the luminous introduction of the doctors and their respective hospitals, I guess we need to give them a thunderous round of applause. Thank you for coming here, because as I had mentioned at the beginning, Jaan hai to jahan hai, and health is true wealth. And all the wealth which is created, if there is no health, I guess we cannot enjoy it. So on this panel discussion, we are having the super specialist as already shared. We go around knowing more about what's happening in their respective fields. My first question is to Dr. Swapnil Sharma. Under which condition are liver transplant suggested?
If you see the indications of liver transplantation, cirrhosis of the liver is the most common indication of liver transplantation. Apart from cirrhosis, acute liver failure, metabolic liver diseases, and some cholestatic liver disease like biliary atresia in pediatric age group. So these are the indication of liver transplant. If you see the most common indication of liver transplant, cirrhosis of liver, we do not advise liver transplant to all cirrhosis patients. We advise them for liver transplant only when they have some kind of decompensation. Decompensations means complications related with cirrhosis, like they have fluid in the belly, they have infection, recurrent infection, they have GI bleeding, blood vomiting, blood in the stool. So these are the decompensation. If they have decompensations which cannot be managed medically, in that case we advise them for liver transplantation.
It's wonderful. So I guess with this, we know what are the specific conditions and one doesn't have to really fret when they have the issues. My next question is Dr. Harshal Lahoti. Recent developments in technicalities of performing angioplasties.
The interventional cardiology field has been blessed with innovations, and we have developments coming up every few years. So, a lot has changed in the last few years in the way we do angioplasties. Earlier, putting a stent across a blockage was the only aim or goal. But now we know that only putting a stent is not enough. We also have to understand how well it is put, modifying the calcium across the block, ensuring that the stent is well placed at the appropriate position, and ensuring that it is well expanded throughout the length, ensuring that it is well opposed across the wall of the artery. All this goes a long way in helping the long-term outcomes, in improving the long-term outcomes of angioplasties. This is what is called as precision angioplasty. So we are aiming for as accurate angioplasties as possible. And the technologies that are helping us with this is intravascular imaging. So we are actually looking the artery from inside out using intravascular imaging like intravascular ultrasounds, OCTs. So it's like putting a camera inside the artery, visualizing it completely, and then assisted by this technology, we are going ahead and placing the stents. So it helps enhancing the accuracy. Also, the stent technologies have changed a lot. Now we have fourth generation drug-eluting stents, which are very thin struts, which have a very thin surfaces. And they're drug-coated polymers, the polymers which elute the drugs, they are absorbable nowadays. So they don't last once their function is over. So all this also helps reducing the failure rates of the stent. So earlier the stent failures or the stent restenosis rates used to be 10%, 15%. Now we are getting the stent restenosis rates less than 1%. All this technology has really helped.
Moving from 10% to 1% indeed makes a big difference. And I guess that we could have a happier heart with the technologies, with angioplasties. My next question is to Dr. Ramakant Deshpande. Where do you see the future of healthcare, and how can we prevent cancer with effective healthcare measures?
It's a very general question. Now, do you want me to answer overall healthcare or in cancer field?
Especially in cancer, I guess.
Cancer field. Okay, all right. Let me just give you a background of the whole thing. Last year, I think we touched a population of 140 crores, and about 15 lakh new cancer patients were registered for the first time in our country. That is a very less amount of percentage for 100,000 people. USA has 400 people for 100,000 people as an incidence. We have about 135. Appears very small. But we want to become the USA, so you are going to go there, which means that today we have as many cancer patients as what USA has today. We are going to be increasing for about 4 times as much. Are we covered entirely for these cancer treatments? Not yet. About 70% of our patients get treated in organized institutions, right? So about 30% are still outside. Now 30% doesn't appear to be a very large number, but 30% of 15 lakhs is 4.5 lakhs. That is equal to probably a population of entire Bandra or Ghatkopar. None of them are getting organized kind of a treatment. So that is a kind of reality as of today. This reality is basically because we don't have adequate institutions, number one. We don't have adequate number of personnel. We don't have adequate technology on the ground. So this is the reality of the situation. And mind you, I think this is there for all our fields, okay? This is the reality of things. Because the resources are scanty and they will continue to be scanty. Even in a developed country, you'll have the same kind of a picture. You're never going to get an adequate kind of a manpower, which is like to the last person is going to be available within this thing. But our response times are getting better. Access to the healthcare is becoming better. And see, everybody is trying to make an improvement in the healthcare institutions. The central government, the state governments, there are NGOs, there are individuals like Ratan Tata individually has put up 8 cancer centers in the Northeast, apart from his family putting the main Tata Cancer Institute here. So you have people who are doing all this particular thing. Where are the advances going to really come? One is preventive efforts, okay? Prevent the awareness that there are agents which cause cancer like tobacco, atmospheric pollution is all known to everybody. How strong are we on the public policy platform to stop tobacco altogether. If you eliminate tobacco altogether in the world, and particularly in India, 30% to 40% of cancers will just disappear. Okay, but I think that it's an industry on which millions of people are dependent. So no government has the heart to do it, and I don't want to get into public policy this thing. So that is number one. Number two is. Preventive checkups, where preventive checkups don't prevent cancer, but you can identify cancers in a much earlier stage. For example, it is said I was just reading an American Cancer Association article, and they said that if you identify cancer in the first stage, the expenses are about $4,000. If you identify it in third stage, it's about $40,000. So you can imagine the kind of difference that you will have. So same thing happens in India also. One of the commonest reasons for personal bankruptcy, both in US as well as in India, is the medical expenses incurred for chronic ailments, be it renal ailment, for example, Dr. Shah's renal failure, you say, a cardiac problem, chronic cardiac problem, you putting a one valve inside this thing is about 35 lakhs of rupees. And how many people can really afford that? So if you identify problems much, very, very early stage, so we are going to, over a period of time, preventive checkups are evolving. They are becoming part of an insurance policy, which were never happening. It's becoming a part of organizational policies. It's becoming a part of the government policies. So preventive checkups is number one. Number two is institutions, as I mentioned. Third is technological advances. Technological advances, for example, one of the biggest advance which has happened off late, which people hear of, is the use of robo in this thing. Now, the moon liver, this thing, the machine which moved on the moon, gathering all the samples, was used actually in the human beings for the first time in 2000. And incidentally, it was by one of the Indians called Dr. Mani, who was a urologist. And he brought it in by 2002. You started getting robos all over. But the thing is, the company which manufactures those robos, Intuitive, is an American company. Americans have a way of dealing. Right or wrong is not an important thing, but it's like they will sell only an excellent car. German will sell only a Mercedes. Now, can we afford a Mercedes? No. So today we have an Indian robo which is almost as good, maybe 80%. So technology is improving. Technology is getting Indianized. Data, obviously, data crunching, the artificial intelligence-based kind of analysis of data, application, policies, everything is improving in India. So things are definitely getting better here. And the way I see it, on a very gross level, what I would suggest is, when I started my residency in the last century, now I'm not 100 years old, but last century was just 24 years back. So I would say that maybe about 30% of people who walk into a cancer hospital would get cured. Today, that figure has come to about 55%, which is a great advance. But mind you, while looking at it, always look at somebody who's ahead of you. China, 65%. US, 70 to 75%. So that is the thing what we have to look for. So identify cancers early, treat them well, treat them affordably, treat them with the best techniques and at minimal expenditure to the candidate, get the best cures and rehabilitate them best. So this is where we are going.
Wonderful. The evolution journey from where it has started and where we can look forward to. That's very important, as rightly stated by Dr. Deshpande. My next question is to Dr. Sneha Shashank. How do we identify stroke at its early stage?
I think this is one thing which I am working on to spread awareness about how to identify early stroke or stroke in its early phase. Cardiology, Dr. Laut is there, so their campaign is always there. If you have something here and you will rush to the hospital that I have got possibly a cardiac event and check me. So most of the patients come in the casualty every day in the night with some kind of heaviness here, and 90% of them are some anxiety or minor ailments, whereas 1% can be actual cardiac. Whereas the reverse is true with neurological part, where stroke, most of the patients take it lightly, even if speech is slurred or some weakness in the hand, some numbness. So they will try to avoid going to the hospital, saying that dab gaya hoga haath, something must have happened, so maybe by tomorrow we'll go to the doctor. So they will rush to the hospital thinking that it can be a stroke. So awareness is one thing which is lacking in our atmosphere. So I think we, as a neurologist and physicians and all over people around should take it as a challenge that the awareness about stroke should increase. The very simple thing, clinically, anybody can diagnose that it is early stroke when the face deviates to one side, speech becomes slurred, and the arm or leg becomes weaker. So it's time to reach to the hospital. So we have devised a phrase which is called FAST, fast. F means face, which face is getting deviated. A means arm or leg getting weaker. And then speech, S is speech getting affected. Then it's time to reach to the hospital or to attend to a neurologist. We are extending this term to be fast, where even some balance problem, dizziness, vomiting, or your eye is becoming blurred, or the vision is getting blurred. So even that is included nowadays in the stroke. So it's not necessary that you only have weakness on one side and it's stroke. Sometimes it is in the back part of the brain and where the imbalance, dizziness, vomiting, and altered sensorium can be the presentation of a stroke, which we say that there is no weakness, so why to go to the hospital? So these are simple things. Be fast. We are trying to promote this particular phrase. And I think through your channel and through your awareness programs, we should get associated and this awareness should go to everyone.
Yes, it's very, very important to be aware, as rightly mentioned by doctor, that if you are aware, you can prevent a huge lot of discomfort which you will gather because of your negligence. So yes, act fast and be fast. We all have to remember that. We come to the next question to Dr. Arun Shah. Majorly, we see a lot of people in having issues with their kidney. Many people we have heard, I guess all of us, some part of our life, we have heard somebody is having issues and they have to go for dialysis every day, every week, every month, whatever time it could be. So I would like to ask you, Dr. Arun Shah, what are the causes of kidney failure?
Yeah, at the outset, I thank Midday and my organization to ask me to come here. Now, coming to your question, what are the causes? In Indian study, it has been observed that 15 to 17% of adults have chronic kidney disease, and it is very easy to diagnose chronic kidney disease if you do your urine routine, your creatinine, estimated GFR, and sonography. The test doesn't cost more than 2,000 rupees, and if you do that, you will know about your kidney status. Now, we always tell in all teachings, anybody who has hypertension, who has diabetes, who is obese, and who has bad habits of smoking and alcohol is likely to develop chronic kidney disease at some stage in their life. Now, chronic kidney disease does not mean that you go on to dialysis all the patients. There are the major causes, as I said, diabetes and hypertension and overweight. There are 5 stages. Stage 1 and 2, we ignore, it can be age-related. But stage 3 and 4 and 5, which can be non-dialysis, it's CKD, that is how we call it, which is still managed with medications and diet. And stage 5, when the function comes down less than 10%, you need dialysis or transplant. Now, as I said, in kidney disease, the prevention is very important. And I always tell my patients that you don't die of kidney failure. You die of your heart disease or your stroke once you have kidney failure. So it is not a one disease, separate disease. It is either related with your heart or lungs or liver or brain. It's always interrelated disease. And if you look at brain, heart, lungs, liver, and kidney, these are 5 important organs to remain alive. If your brain fails, more than 90% you can't live. If your heart fails, more than 90% you can't live because you will need heart transplant, which is not very common. Lung transplant is not very common in India. You can't live. Liver transplant, now it is common. But in kidney transplant, when your kidney fails, you don't have to go for transplant immediately. You can go on to dialysis as a bridge therapy, and then you can find out a suitable donor. which can be a deceased donor, life-related donor, altruistic donor. You can do a swab transplant, you can do a bio-incompatible transplant, and you can live a long life unless the results of liver transplant or heart transplant or lung transplant, kidney transplant results are excellent. So, of the 5 major organs, there are tremendous innovations have been done in kidney diseases, and one should not lose hope once they develop kidney disease. And the treatment which was not affordable before, 30 years, 35 years, and people thought only rich people will take dialysis treatment or transplant treatment. It is not true. Now in city of Bombay, there are so many charitable organizations which give dialysis at 500 rupees, 600 rupees, 700 rupees, and you have cutting edge hospitals which give costlier dialysis, and same dialysis, but in a more costlier therapy. So you should always advise all the patients who are diabetic, hypertensive or obese should do a yearly checkup for their kidney disease. If there are so many preventive drugs to prevent disease progression, and they should start on the treatment much early to prevent kidney failure requiring dialysis or transplant.
Such an in-depth understanding about how we can keep our kidneys healthy. Thank you so much, doctor, for that insight. I have a question for Dr. Swapnil Sharma. Is NASH really dangerous?
It's a simple question, but difficult answer. So first we have to understand what is NASH. So there is a term in medical science, NAFLD, non-alcoholic fatty liver disease. So NAFLD, it's not a single disease, it's a spectrum of disease, which includes three things. One is fatty liver, then NASH, followed by NASH-related chronic liver disease. Full form of NASH is non-alcoholic steatohepatitis. That means patient is patient is not consuming alcohol, or he is consuming minimum amount of alcohol. So fatty liver means the fat deposition in the liver. Whenever there is a inflammation of fatty liver, it is called NASH, and whenever there is fibrosis of NASH liver, it is called NASH-related cirrhosis or chronic liver disease. The thing is, fatty liver and NASH, they are reversible stage, and NASH-related cirrhosis, once patient develops cirrhosis, it is irreversible stage. So if you see the risk factor of NASH or NAFLD, obesity, diabetes, dyslipidemia, hypothyroidism, so these are the risk factors. Once patient develops cirrhosis, it is irreversible stage, and in future they will need liver transplantation. So as per NASH is not dangerous, but once they develop cirrhosis, they will need liver transplantation. So I can say the NASH is dangerous if you ignore it. So if patient is having fatty liver, they should take it seriously. If patient is having NASH, they should take it seriously. They should consult their gastroenterologist or hepatologist, and they should start medication. They should change their lifestyle, like they have to reduce their weight, they have to do regular activity. If there is hypothyroidism, dyslipidemia, so they should start medication for that.
So yes, again, it comes as you need to be careful, aware, take the necessary steps so that you don't go to the stage where you need a liver transplant. Thank you so much, doctor. I would have a question with regards to cardiac issues. Dr. Harshal, reasons for cardiac issues and heart attacks in current times, especially post-COVID.
Post-COVID, definitely the incidence of heart attacks has increased. We have seen it ourselves also in general. Literature-wise also, there has been a good 30% increase in incidence of heart attacks, especially in young individuals and individuals less than 50 years of age. The reason of post-COVID increase is that the COVID virus is, we all know, it's not a common cold virus. It generally does not only affect the respiratory system. We know that it is affecting the whole body as such. It's affecting the heart. It's causing inflammation within the heart muscles. It is also causing long-term inflammation within the heart vessels, in the blood vessels of the heart. And because of this increased inflammation, there is increased risk of thrombosis or clotting formation and increased risk of heart attacks. So having a COVID infection is a new risk factor for long-term heart problems. Is as big a risk factor as smoking, alcohol, or other lifestyle problems is. Now, what to do once we have COVID? Of course, the risk increases, but we cannot change the history. We have had COVID. We have had COVID. So the thing that we can do to prevent heart problems after having COVID is address other risk factors which are modifiable. So quit smoking, quit alcohol, improve your lifestyle, improve diet, improve physical activities, control of cholesterol, blood pressure, controlling stress, because post-COVID, not only the COVID virus is causing problems, but the stress of this COVID pandemic has also increased to some extent the presence of heart attacks. So controlling our stress and reducing the stress is also an important factor.
Yes, wonderfully put that we all need to work on what can be controlled rather than focusing on what cannot be controlled and moving ahead and taking the necessary measures to prevent them. Thank you so much, Doctor. I have a next question for Dr. Ramakant Deshpande. What is the biggest challenge you feel comes in healthcare management?
The healthcare management, particularly as applied to this thing, one is the manpower challenge. That's what we face now in every location. Is the specialist in the people who are sitting here, whatever 5 numbers, they have actually their student days were at least 10 years after the MBBS, right? So to qualify as a nephrologist, qualify as a cardiologist, qualify as this thing, and that is where their actual experience starts. So that takes another 5 to 10 years minimum. So, you can't really create a cardiac surgeon or a cardiologist or a nephrologist overnight. But if your requirement for these kind of specialties goes up exponentially, then that is something which is always going to be in short supply. Technology actually can overcome this, because now what is happening is post-COVID, acceptance of internet-based consultations, planning, the artificial intelligence, everything. For example, surgery, if it's still not in the practice, if my friend wants to do a renal transplant or a hepatic transplant, if sitting here in Mumbai, technically, in another 5 or 10 years, he can do it in probably in Kashmir, because the robo will take care of everything. People who are less trained than him, maybe technicians or junior doctors, can set up things, and he can actually control the robo sitting here on an internet. The 4G had a lot of interruptions. So what happens when you cut something and suddenly the lights go? Then you're in a mess. 5G is definitely better. 6G is just about to come, and I think 7G and all that will make this particular thing, Internet of Things, very, very smooth. So technological challenges will be overcome over a period of time. The robots will be made much smaller. It can actually help us tackle into this thing. The advances next is in the lab. Theoretically, is it possible to grow an organ? The cell technology can go up to that level, and it's, this is still in experimental phase, but you're looking at it probably in another 20 years down the line. There are so many things which we are doing today which were unthinkable. They were never thought. Robotic surgery was not thought in 2000, right? So the growth of this thing, for example, now Dr. Shah says that, okay, this kidney is not functioning, you need to have a renal transplant. Suppose if you can grow that kidney in a lab, it's not very difficult. It's not very easy. See, heart transplant is a much easier thing. It's only heart muscle. Kidney has got 20 different types of tissues. It's much more complicated. Surprise, we don't realize this. But this is what the whole thing is about. But if you can grow this particular thing in a lab, all that you need to do is you just need to indent that along with your scissor, there's that, along with that one kidney. And then the kidney is just replaced. So this is the thing we are actually going. So these are all the challenges. Things are happening slowly and steadily. But the way we practice medicine today and the way we'll practice medicine 30 years later will be entirely different. This is how things are improving.
Thank you so much, Dr. Ramakant, for throwing light on what could be expected in future and how we can overcome or bridge the gap between what we need and what is available. Thank you so much. Now coming to the next question, it's with Dr. Sneha Shashank. I want to ask you, What is migraine? It's often told, many people, even youngsters, they have like migraine. बच्चों को पढ़ाई करने बोलो तो migraine हो रहा है. So what is migraine and how to diagnose it in the general population?
Yeah, it's very pertinent question because this migraine is like a very common headache. If in this population of people sitting here, I can ask almost every third person must be having a history of headache, some headache in their lifetime, frequent headache, occasional headache. So headache is very common. I think every second person or third person must be experiencing. But to label it in migraine, there are certain criteria that has to be fulfilled because we loosely apply this term to any headache as migraine. That is also to be avoided. And there are patients who have migraine but being labeled wrongly some other diagnosis. So both ways we should be correct. So understanding migraine is very important. It's a very common disorder, but at the same time very misleading term. So I will just give you a few pointers how to make a diagnosis of migraine. Suppose there is a patient suddenly presenting with severe headache, giddiness, vomiting, and wrongly labeled as migraine. Because it is the first time any person suffering from severe headache, vomiting should not be labeled as migraine. At least you should have five episodes of headache at different time period. That means today I got first episode and it is continuing for next 3-4 days, it cannot be migraine. Then if I have severe headache, vomiting today, then after 15 days or 1 month, and then such 5 episodes in my lifetime, then only the level of migraine comes in the picture. And then the most important diagnostic tool is not MRI or CT scan or imaging technique. It is the clinical diagnosis. So by history only we make this diagnosis in clinic. So first thing we ask the direct question, anybody in your family has similar history of headache? And most of the patients say, no, we don't have. But by history, we know that it is migraine. So we ask leading questions in some way that your mother has history of headache. So no. But if we ask, जब वो fast करती है तो सर दुखता है, or if she goes for travel or goes outside in the sun or some exertion and then she complains of headache, हाँ ऐसा तो होता है, बाम लगा के सो जाते हैं, ऐसा होता है. So you have to ask leading question to come to the diagnosis. The first thing is it is familial. It has genetic component. So that's why somebody in the family should have, your father or mother side. And then if you have headache, your brother or sister can also have headache. But it cannot be same frequency, same severity. So that's the difference. Most of the patients say, मेरे जितना नहीं होता है. So that should not be the case. It is the pattern should be episodic headache associated with certain features like photophobia, difficulty seeing the light, phonophobia, then irritability, vomiting sensation, nausea, and then it peaks over a period of few hours and then settles down over a period of 3-4 hours. If you take medicine, simple paracetamol also in the early phase of your headache, it settles down. Or if it is severe, then you have to take painkillers. And even if you are having vomiting-like sensation, then nothing works. Either you have to wait for the vomiting to come and then it settles down after sleeping for 3-4 hours, or you have to visit some doctor to take injections. So migraine is easy to diagnose, but you have to be aware that you cannot label every headache as migraine. You have to have 5 such episodic headache before you label it as migraine.
Thank you so much, doctor, because I guess every time a person gets a headache, they think they want to label it, it's something big is happening, migraine ho gaya. Now, with these 5 episodes, knowing that it is not an unfamiliar aspect of life, so I guess he's thrown light on understanding how we can diagnose migraine by ourselves initially and take the necessary measures. And then, of course, we have a specialist to whom you can go to. And we move ahead to Dr. Arun Shah. And my question to you is, what are the symptoms of kidney failure and what are the possible investigations?
Yeah, that's a good question, because as I said, almost all diabetics, 40% of them will develop chronic kidney disease at some stage of their life. All hypertensives will develop kidney disease at some stage of their life. So 80% of patients are asymptomatic. They have no complaints. Only when you do your urine routine, when it shows persistently protein in the urine, then you have got chronic kidney disease. Your creatinine rises, then you have got a kidney disease. Your eGFR falls below 60, and you have got chronic kidney disease. So 80 to 90% of the patients are asymptomatic. But in adult life, for general population, if somebody loses weight for no other reason, somebody's hemoglobin drops, somebody starts vomiting, or starts developing swelling over the legs. So swelling is the one where patients are always misguided. If somebody starts vomiting and loses weight, and when we investigate, creatinine is high, we tell them your kidney is swelling. They'll say, but we have no swelling in the leg. Palm and sujani, but that is very rarely it happens. The first thing what happens is loss of appetite, loss of weight, hemoglobin drops, your blood pressure becomes uncontrollable, and your sugar level drops. So we always tell all diabetics, if your sugar, which is always not very well controlled, and suddenly you start developing episodes of hypoglycemia, then don't be happy. Your kidney is failing, because for so many years you have not controlled your diabetes, and now because of kidney failure, the drugs which you are taking are not being metabolized, and they are causing your low sugars. So you have to immediately take action, go to the doctor, get investigations done. And as 80% of the patients have no symptoms, we tend to see patient in very late stage 4 or stage 5. And even now, after so much of education, 10% of the patients straight come for dialysis for the first time. If you ask them, they will give you no history. But there's a caveat. You are diabetic, you are hypertensive. Your creatinine stays around 2. You have no symptoms. But you ran or you had some joint pain. You took some painkiller drugs. And 2, 3, 5 days, if you are unlucky, your kidneys can fail. You can land upon dialysis. Similar is the case with Ayurvedic drugs. If you take unchecked Ayurvedic drugs in a patient who is diabetic, hypertensive with a borderline kidney function, you can land upon dialysis. So patients who are diabetic, hypertensive, elderly patient should not take any medication without consulting their doctor. If you have any doubt, take your paracetamol or a dolo tablet and consult your doctor if your pain persists. Don't do self-medication, because in kidney disease, your neighbors will advise you more than your family doctors or your consultants. So please avoid doing that. Now, those 80% of the patients who are asymptomatic, they don't have to lose heart. Suppose if you diagnose you have kidney function of 50%. If you control your diabetes and control your blood pressure, you can prolong this disease for another 20 years and delay the progress of disease. You can avoid dialysis, you can avoid transplant. And there are so many good drugs, both for diabetes and blood pressure. They not only control diabetes, but they also prevent progress of kidney disease. Same thing in blood pressure. A certain group of drugs, excellent drugs, they will control your blood pressure as well as it will prevent progress of kidney disease. So if you do these two things very well, if you avoid painkillers, if you avoid Ayurvedic drugs, stop tobacco. Tobacco is not only the entitlement of cardiologists. Heart and kidney goes hand in hand. People who don't stop tobacco, if you have diabetes and hypertensive, you will develop your kidney disease early. So symptoms in late stage of kidney disease is nausea, vomiting, weight loss, swelling of the legs, breathlessness, and drop in hemoglobin. But this is in late stage of disease. The early stage is picked up only by regular checkup.
Thank you for the detailed insight about these important questions as how we can keep our kidneys healthy, and in case something goes wrong, how can we prevent it from going into a stage of being in failure. Thank you so much, doctor. We have our next questions for Dr. Swapnil Sharma. Can we do liver transplant when the patient is having liver cancer?
liver cancer or hepatocellular cancer, this is the fourth most common cause of cancer-related mortality all over the world. But the good thing is we can do liver transplant. We have liver transplant as a treatment modality. We can cure liver cancer by doing liver transplantation. Provided the tumor is limited to the liver, it is not going out of liver. And the other thing is it is not infiltrating the blood vessel inside the liver. Then we can go ahead with liver transplant and with success rate approximately 90 to 95%. There are other ways of managing liver cancer patients, like we can go for liver resection, some loco-regional therapies like radiofrequency ablation, chemoembolization, radioembolization, but they are just bridging therapy. If patient is not having donor in the family, in that case we can use these modality. But the good thing is the liver transplant. I should say the liver transplant is the greatest evolution for a liver cancer patient.
With a good success rate, I guess you give new ray of hope to liver cancer patients. Thank you so much, doctor. My next question is to Dr. Harshal Lahoti. What are the preventive measures one can inculcate for a healthy heart, and how to handle sudden chest pain?
The first part of question, healthy heart, I mean, the preventive steps would be a general healthy lifestyle to begin with. That goes with sleeping at the right time, waking up at the right time, having good 7 to 8 hours of sleep, walking around 40 to 45 minutes daily, having a healthy diet which would have lots of raw vegetables and fruits, less of junk food, less of oil, less of refined products like refined wheat flour, refined oils, refined rice or any polished rice. So whatever is healthy is okay in diet, and having stress-free lifestyle. I mean, having as less stress as possible, having good working hours, good 7 to 8 hours of working is enough. I mean, generally people go for 12 hours, 13 hours of work in urban lifestyles. So that is impacting health in a wrong way. And having good work-life balance, having good balance of your work as well as your family life, your rejuvenation time, your refreshment time should also be enough. So having a good, disciplined, healthy, balanced life is what is the recipe for a healthy heart. Is not only the recipe for healthy heart, is recipe for healthy body in toto. So the first thing that you do when you have sudden chest pain is believe that the chest pain could be heart related. What most people do is they have this denial that, oh, I cannot have a chest pain, I cannot have a cardiac pain because I am otherwise healthy. So what has happened with most of our patients, especially cardiologists also, we have had few cardiologists who have had their heart attacks or chest pain, which they felt was initially was they felt it was gastric pain, so they themselves ignored it, cardiologists themselves. So and later turned out to be massive heart attack. So the first thing that you do is believe that okay, it can happen to me, that this chest pain can be cardiac, and it can happen anywhere. It can happen from throat to umbilicus, in front or in back. It is not typically that we always have thought that it could be left-sided, it could be radiating to the arms. It's not. It does not always happen that way. Second is when you have chest pain, try not to get more excited. Now we have had patients who wanted to come to the hospital with chest pain. They from the parking they started running towards the casualty, and that worsened the cardiac symptoms. So try to rest as much as possible when you have chest pain. If you have Disprin at home, Disprin 325 milligram tablet, try to chew it, not gulp it, chew it, so that it acts faster that way. So Disprin is a blood thinner as such, and it will help resolve the clot by the time you reach the hospital. And the most important thing to do is reach the hospital as early as possible, get an ECG done. If the ECG is normal, then more than 90% times the issue is sorted and we don't have any cardiac issue. If there is some doubt with the ECG, then we may repeat it after 15 minutes, 1 hour, 3 hours, 4 hours, or we observe the patient for 24 hours with serial ECGs. And we can do a cardiac enzyme also. So that's troponin test, which is a very sensitive marker of cardiac injury. So even 1% of the heart muscle is damaged, the heart enzymes increase in the blood. And we can detect a very minor heart attacks also with this test. So this is available all around in all across major hospitals and emergency centers. So getting an ECG done, getting a troponin test done, and reaching the hospital in time, I think is the most important thing we do when we have chest pain.
Thank you so much for the detailed understanding about cardiac pain is not just at your chest, at the left of the heart, and you say the hand is where it's radiating to, or the jaw is where it's radiating to. So all the various bumble points which you have shared, I guess, is going to help a lot of people around the world to know that if you can handle your heart, you can handle your life. So don't be in anxiety, just do what is needed. And that was really very, very important. All the bumble points, the guidelines were truly very important. Thank you so much, Doctor. Now I would like to move ahead to Dr. Sneh Shashank. What are the common myths about epilepsy in India?
Because in our society, epilepsy is one thing which has the biggest taboo. And I deal with these kind of patients every day because 15-20 minutes is just to remove the misconceptions from the patient's mind, their relatives' mind, and then the society comes at a later stage. First thing, our patients in themselves have a lot of misconception about the epilepsy. Then society at large, yes, this epilepsy is known since the mankind is evolved. So this is the oldest, one of the oldest disease we have, and very well documented. And that's why a lot of myth is also around it. Because suppose the patient 200 years back, a patient suddenly used to get convulsion. So they used to say that some superstition, some upar ki hawa, some black magic or something of that sort has led to this kind of situation. Because after 2 to 5 minutes, patient used to become conscious and back to normal. So there was something wrong. Somebody has done something wrong. So this is the concept is still persisting in our society. So we have to remove this by talking more about it at different platforms. As I was talking about the stroke part, same way it goes with the epilepsy. So the first thing is in our society that it is something supernatural or black magic kind of thing. So they go to quacks or some baba or some spiritual person. They do something, and then because patient becomes conscious after some time, then they think that it was definitely something wrong. And then they say, ye karo, wo karo, and they get in that loop where they are exploited basically for want of money or different motives are there. But the other thing what people talk about, think about this epilepsy is that it is genetic. Most of people feel that if the person has epilepsy, that means his next generation, 7th generation will have epilepsy, or the father or mother must be having epilepsy. So while counseling for females, it is very important for us to make them understand the families that it is not genetic. And 99% of the patients are not having genetic type of epilepsy. It is sporadic. Anybody can have it. Only 1% of the epilepsies have genetic basis. Okay, so 99% patients are being paid for that 1%. So it is our duty to clarify at various levels that it is not genetic in most of the patients. And if it is genetic, it is always there in the history that father had epilepsy, the son is having, his son is having. So you can see the genetics by history also. But labeling any epilepsy as genetic is wrong. So we have to clarify this. And then there are myths around that once patient is actually convulsing, what to be done. Many times people just put a spoon in the mouth or put water in the mouth or some onion is put around the mouth, shoes or metal object is given in the hands. So all these kind of things people do to save the life. Everyone tries to do some efforts to save the life, but most of the time they don't know what is the right thing to do. So we educate most of the patients first, their relatives, and then because whatever they do, most of the people who are looking around at that point of time, they think that this is the right thing to do. So if somebody is convulsing on the road, people are putting something, onion or so they everyone around 50 people say this is the right thing to do. But if one person does the right thing, maybe 50 people are automatically educated. So right thing is to keep the patient on one side, if possible to left or right, whatever easy for you to do. First thing is that keep the patient on one side, so saliva or whatever is coming out of the mouth should get the passage to come out. Second thing is keep the patient safe. If there is any sharp object or anything where a person is convulsing, so he should not get hurt. If the tight clothing is there, try to remove that. Let the air around the patient be there. Not 100 people are just jumping on the patient doing something or other should be avoided. Let the patient be all alone. One person should handle that. And for 2 minutes, most of the convulsion lasts for not more than 2 minutes because by then your breathing is not there. So how much I can hold for my breath? Maybe 2 minutes maximum. So during that time, the body is convulsing. After that, anyway, brain takes over and the convulsion is stopped. And thereafter, patient starts breathing heavily. Deep breathing takes. And suppose I have put water or something in the mouth, then patient aspirates. So that is where one should keep the patient on one side, not straight. Don't put anything in the mouth. Don't try to force any spoon or anything in the mouth because then you'll break the teeth. And because the clenching is so hard that no one can open it up. So there's no point for 2 minutes doing all these things. Anyway, patient will relax after 2 months, open the mouth. And then another 2-3 minutes, 5 minutes, 10 minutes, patient is dazed, confused, and then thereafter regains consciousness. So it is the message that should go across that it is for 2 minutes and one should not be doing everything, whatever comes to your mind. Just be mindful while handling such patients. And definitely it is not genetic in most of the cases and no superstition involved in this. Have a proper diagnosis, have proper medicines. There are beautiful medicines available nowadays which control your epilepsy to the tune of almost 90 to 100%. There are few 5 to 10% patients who are difficult to treat, where 3, 4 medicines are going on and still their convulsions are not under control. So their epilepsy surgery is now available and most of the patients are benefited by that. So all this started, how it starts and how we can give the treatment, best possible treatment, including epilepsy surgery is available in most of the government hospitals. That is the beauty, that it's not necessary that epilepsy surgery we have to go to private institutes or bigger institute. It is available in government hospitals also nowadays. And it's very cheap, affordable nowadays. So we should guide the patient properly.
I guess this is a very, very important message to all the people who have seen or are related to people who are having epilepsy. Because the myth around that whole concept itself is so frightening that people are not able to look beyond that there are so many possibilities where they could heal themselves. The medical system has been evolved so much that they can be treated. So thank you so much, Doctor, for this ray of hope. Coming to Dr. Arun Shah, I wanted to ask you one question, that what is the treatment for kidney failure?
So, as I said at the outset, kidney failure we divide in 5 stages. CKD stage 1, 2, 3, 4, 5. And stage 5 is non-dialysis stage and dialysis stage. So stage 1 to 5 non-dialysis, the treatment is good treatment of your blood pressure, your diabetes, avoiding painkiller drugs, avoiding Ayurvedic drugs, and diet. If you can become vegetarian and restrict your protein in the diet, you can prevent progression of kidney disease. But the most important thing still remains is control of blood pressure. Then once you develop kidney failure, diabetes loses its charm, You have to keep sugar slightly higher up. Your HB1AC has to be around 7, not 6.5. But if you control your BP at 130/80, then the progress of kidney disease can be prevented, rather slowed down. Once you develop stage 5 requiring dialysis, where your kidney function has come down less than 15% or 10%, when you start vomiting, when you start losing weight, when your hemoglobin drops below 10, or when you start developing swelling, when you can't sleep flat because of the water in the lungs, you need dialysis. Now, what is dialysis? People are very worried about dialysis, but dialysis is like a washing machine. How when your clothes are dirty, you wash them. Same way, when your blood is impure with toxins like urea, creatinine, phosphorus, and potassium, you wash it. Alternate day, 4 hours, and you remove all those impurities. That does not take function of kidney completely, but if you take 12 hours of dialysis in a week, it takes about 12 to 15% of kidney function for that week, and that is enough to live well. Now, if you still want a better life and better quality of functionality, then you should do transplant. Transplant can be both live-related and deceased donor, where you get a cadaver transplant. And in live-related, the government allows father, mother, brother, sister, wife. Though she is not blood-related, since she is emotionally related, they give you permission to donate. Now, this extended donor, like your uncle, auntie, grandparents, cousins, they also, if they can prove the identity that they are your cousins or uncle and aunt, they also can donate kidney. And as I said at the outset, we are lucky to have 2 kidneys, and one can live normally with 1 kidney. So kidney donation is something which should be advocated for the family members. And recently, not recently, people have been doing for many years. We do a PO incompatible also. So far, suppose if somebody has a B blood group, so he can have kidney from either a B blood group relative or O blood group relative. The O blood group is universal donor. Somebody who has A blood group will have only A or O as a donor. But now we also do across blood group also, where little cost comes up a little more. But a donor can give kidney to B donor, B recipient and O recipient also. So there is extended indications of the donation also. The cost of transplant has come down, the medications have also come down, and those who cannot afford, if they have their orange card and certain prerequisite certificates for below poverty line, all major hospitals, they do their transplants free. It's not only government hospitals, even in private hospitals, we have done free transplants for people who fall into below poverty line. So the treatment of kidney failure remains first thing is control of blood pressure, second is control of diabetes, third is your diet, fourth is avoiding toxic drugs like painkillers and Ayurvedic drugs, and then dialysis and transplant comes last. Thank you.
Very clearly stated as how we can take care of our kidney and what is the possibility of getting it back to good health. So thank you so much, Dr. Arun Shah. Now I have a question which is to Dr. Ramakant Deshpandeji. What are the current trends and developments in the prevention and cure of cancer? Current trends, it's a very fast, rapid-fire question, I would say.
Yeah.
What are the current trends and what is it that you see that in future also it would be helpful?
Prevention, first and foremost, is the counseling about the bad habits, like reduce your smoking, if you can avoid atmospheric pollution, so you can, there are people who with interstitial lung diseases, they better change the city itself or place of work, maybe place of your occupation or whatever it is. So as far as prevention is concerned that way. Secondly, regular checkups, you must have regular yearly checkups, etc. for prevention. Healthy living, like what my friend said, a good sleep, good diet, good exercise, whatever medications you're supposed to take, like what to integrate what Dr. Shah said, control your hypertension, control your diabetes properly, both metabolically as well as medicine-wise. So all these things will make you a little more healthy. Then we have the preventive checkups. Now, preventive checkups in case of lung, in case of breast, in case of cervix, colon, etc., are very, very well established kind of parameters. The checkups which need to be done for those are very established. For example, for the lung, what you do is not only a chest X-ray, but a low-dose spiral CT scan. And the diagnosis can go up 8 times more in a much smaller stage. So you can diagnose a cancer lung rather than in a 3 centimeter size to a 3 millimeter size, which has a 97% cure rate if you actually treat it in time. This is the number 2. Number 3 is metabolically you check the blood. There are some predictors of, there are tumor markers which actually can predict whether something is happening inside your body. Many of these things are still evolving, because what happens is if there's a tumor formation, it breaks into small pieces which start circulating in your blood, which can be identified, So these tumor markers can actually be identified. So when you, apart from your healthy living, there is a cancer checkup. During the cancer checkup, there's a radiological checkup, as I said, and there is a biochemistry checkup and the blood checkup. So these are the things which we actually can use in terms of early identification or even preventive kind of a checkup. When the tumor actually occurs, then we take benefit of molecular diagnosis. For example, the fact that there could be a genetic kind of a precursor in case of cancer was realized much earlier, but till 1990s, we could not really do anything about it. It's just hypothesizing. But the computing power of the computers went up phenomenally high in the 1990s. So what they said is, okay, when we analyze the genes with there's a chromosome, each one has a specific amino acid. And there are millions of those. Humanly, it is not possible to identify and count them. So what the US did, where it all started originating in the 1990s, the hypothesis came up. Then they said, okay, by 2030, we will actually use our computers and find out what is the common genome. It's GCP, it is called genetic common profile. So, but what happened, one very innovative thing happened is they combined the sleeping computers of all average people also, and that thing became available in 2002. So then in place of 300,000 genes which were predicted, they found that actual number is about 125,000. If there is an abnormality in a gene, that abnormality is associated more commonly with a malignancy. Now this, not only at a diagnosis level, but even at a prediction level, it was becoming possible. So once you know that, yes, this is an abnormality which can lead to a cancer, what is the next thought which comes to it? Can I really correct it? So there's CRISPR technology, which means that you identify that gene and can you manipulate that particular gene? And happily enough, in 1968, Hargobind Khurana, an Indian, identified this technology. And now it has come to the fore. And it is now they have started using this particular thing, not highly successfully. In the next 20 years, probably even that will happen. So, human beings, check up, avoid everything that causes cancer, identify if at all there is any cancer, identify a preventable kind of a cause, and correct that particular thing. So this is how we are going to go.
It's a wonderful journey. We know from where we have come and where we could go. So thank you so much for sharing this journey of evolution in the field of oncology. A very quick question to Dr. Sneh Shashank. Looking at the current scenario, where do you see the neurological issues in the next 2-3 years? Because stress, as we heard, lifestyle, all diseases are somewhere connected to our lifestyles. And also we know that a lot of things have been changing with the changing evolution around us in all aspects of life. A person himself is forgotten what living is and is truly actually a biological being and not a mechanical one. So what do you think would be the neurological issues in the coming 2 to 3 years?
Obviously, lifestyle is the major factor for not only cardiology, nephrology, neurological point of view, but all over body. And most of doctors sitting here, I'm sure he's talking about 7 to 8 hours, all are working 12 hours. So, so I understand that we are care providers, so we extend as much as we can till our body can definitely adapt to it. But at the same time, it is necessary for doctors, caregivers and care providers to take care of their health so that we can provide health to the other people. But as far as this neurological disorders you are saying, yes, as the lifestyle is becoming more and more complicated, hectic, especially in the urban scenario, neurological problems are increasing. In neurology doesn't always mean stroke or migraine. It includes mental health as well, which includes anxiety, depression, psychosis, and all those various issues. So it is neurosciences what we should be talking about, which includes both the mechanical aspect like stroke and actual disease in the brain, and the functional part, that is the anxiety and psychiatric issue. So we should address both. Psychiatric issues are definitely on the rise. And every second person in the city, including students, including children for that matter, are presenting with anxiety and behavioral issues. So they are on the rise. So proper parent education, proper guidance and counseling should be part of our mental health issue. In India, we have found that I have to treat many psychiatric patients also. Reason being, they don't want to go to psychiatrists because they will be labeled as mental issue, mental problem, mental case. Whereas if they come to neurologists, they say some neurological, so it is good. Okay. But it is basically psychiatric issue, so we have to deal with them. But over a period of time, one should realize that it's okay to attend to a psychiatrist or a counselor for your mental issues. So they are on the rise. As far as the neurological issues, stroke is on the rise. Maybe we are identifying more, but as far as the lifestyle issues, the stress is causing a big factor which produces stroke. Same cardiology, whatever factors he has mentioned are applicable in neurology. Whatever advances are happening in cardiology, we are taking advantage of that, going and doing intervention. The only difference is in the cardiology, we still have some time to repair your heart muscles because they are basically muscles all around. And we have some time to revascularize, open up the arteries. Whereas in brain, you have very limited time. And that time starts, every minute we are losing billions of neurons after the stroke. So that's why identifying stroke in time and intervening in time, that is the golden period, what we call window period, is all around 3 to 6 hours. The best time is within 3 hours if patient reaches to the hospital and MRI, CT scan and relevant investigations are done, blood investigation done, and we want to open up the arteries by thrombolizing, giving medicines that can dissolve the clot, or we can mechanically go inside the brain and try to remove the clot, is available now in most of the centers. So all the big hospitals have all these facilities under one roof. That is very important. That patient should reach to the center where all the facilities are under one roof. What happens in our setup, smaller nursing homes are there, smaller setups are there. They write ICU, but there is hardly anything in the name of ICU. So patient reach there and waste their time. The very golden time is lost in getting admitted and then realizing there is nothing over there or can be done. Then they are coming out of the hospital and then getting the investigation done. Because for a CT scan, if I am sending the patient out of my hospital, then I am losing the vital time. So for a stroke, it is very important to reach at the place where all the facilities, including neurological services, neurologist, neurosurgeon, cardiology, cath lab, available under one roof. Then the best services can be provided. And I'm happy to say that most of the hospitals in Mumbai are able to provide this kind of stroke services.
Thank you so much, Doctor, because yes, it means a lot to save your precious time. It was indeed a pleasure to have the stalwarts of the healthcare industry with us. The super specialists here who have shared the knowledge which people, I guess, are not even aware about and living a life in panic and many a time jeopardizing their whole life. Because right time, right treatment, also knowing what holds good for them in the future is also equally important to keep us at a state of de-stressed. As all of you had mentioned the word stress, we need to be de-stressed so that, and with the right knowledge. Because a half-baked knowledge can never keep you de-stressed. We need to have the right knowledge coming from the right people as it has come here, and when we are able to apply then their importance, their pointers, what they have shared in our lives, I guess we will be able to lead a happier life. And yes, most important, having such awareness programs, as I've heard from each one of you, each person, I would say it's not about patients only, but each person should be aware about their own physical body and what goes within it and what can be done if something goes wrong. So be it neurological, be it oncology, be it the hepatitis and the liver conditions, be the kidney or be the heart. all of us need to be enlightened, I would say. That would be the right word, medically enlightened with the knowledge needed to protect ourselves and have a happy, healthy life. Thank you so much for having you all here. And I guess all our audience have received lot of information and will go home de-stressed. Thank you so much. Signing off is Dr. Sujata Singhi, your moderator for this evening. Thank you so much.
Thank you so much, everyone present on stage. We are truly honored for this insightful, informative, and truly helpful discussion. Thank you so much. May I please invite on stage Mr. Vikash Joshi, Managing Director, Midday Infomedia, to kindly come on stage and offer a token of our appreciation to these esteemed panelists and, of course, our moderator. Can we have a round of applause, please? Thank you so much once again for joining us. One last time, can we have a huge round of applause for all our panelists and our moderator?
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.